The DOH backs the easing of face mask mandate outdoors, but only for persons at low risk of catching COVID-19. At a House budget briefing, DOH officer in charge Maria Rosario Vergara says people with weak immunity, the elderly and children are highly encouraged to wear face masks in open spaces. She adds it's too early to say that the pandemic is over despite the declining number of COVID-19 cases nationwide.
The state of endemicity would require that there is high population immunity, which we do not have right now. Masking will just be optional for those who are non-vulnerable. Hindi po pwede sa senior citizens, hindi po pwede dun sa may sakit, hindi po pwede sa mga bata, sa transport sector, and dapat hindi po crowded ang lugar, tsaka maayos po ang daloy ng hangin.
The Health Department's proposed budget next year is 301 billion pesos. The amount includes 100 billion pesos for PhilHealth. Against this amount, the COVID-19 response efforts only get 25 billion pesos from an original request of 95 billion pesos. Vergara says 76 billion pesos will be needed next year to pay the COVID-19 benefits of health workers, but the item was reduced to only 19 billion pesos, or equivalent to only 3 months. There's 18 billion pesos more, but this is part of the budget that is dependent on government exceeding its target revenue collection or if there are excess funds. Vergara says funds are also needed to buy the new generation of COVID-19 vaccines.
We are now in the process of discussions with the manufacturers of these new generation vaccines. These new generation vaccines, based on their studies, would be targeting or can cover both the original strain of the COVID-19 virus and the Omicron variant.
The DOH is also asking 500 million pesos more to help cancer patients in line with the National Integrated Cancer Control Law.
We did our appeal to the Department of Budget and Management, but still we were not given that approval. So ngayon po, mingi kami ng tulong and appeal to our House of Representatives to bring back the Cancer Assistance Fund.
Vergara says DOH is also working with budget officials to pay the 1 billion peso special risk allowance due to over 55,000 healthcare workers. The DBM says it's still reviewing the requirements submitted by the DOH, even as funds are enough to cover the allowance. Cian Arcangel, CNN Philippines.